Whether you're new to Medicare or you've been a member for a while, saving money is important. In this video, I'll go over some tips on how to save money on the Medicare program. For more information on Medicare and how to save money, be sure to check out my YouTube channel here. You can check out my website up here at matthewragudo.com to learn more about Medicare and retiring. Now let's get into the video on how to save money on Medicare. Number 1, shop your Part D drug plan every year during annual election period. As you can see from this study from the Kaiser Family Foundation, those beneficiaries who don't shop every year definitely lose out. There's over 40% of you folks that don't shop your plan. So remember every year, October 15th through December 7th, to reevaluate your Part D prescription drug plan needs. If you need help with that, you can go over to my site. Information's in the description down below or right here on the screen. Another way to save on drugs is to ask your pharmacist when you pick up your medications whether or not it would save you money if you paid with cash or with some kind of a discount card. Now, the pharmacist is not allowed to, in some states, to disclose this information to you unless you ask. So always ask if there's a better way to get your medications. Number 3, see if you qualify for Medicare Extra Help. Now, Medicare Extra Help is a program that Medicare has based on your income and your asset amounts. If you make under a certain amount of money per year and have under a certain amount of assets, you'll qualify for this. It's estimated that this program is worth about $5,000 a year to those people on it. So don't forget to apply for it if you think you qualify. If you do and you want to apply, go here on this Social Security government website and apply there officially. The link is in the description down below. Number 4, again, to save on medications, you can go ahead and see if your brand name medication has a subsidy program. Also on the Medicare Gov website, you can go and see if your drug has one of these programs available here on screen. Next, number 5, avoid late penalties of any kind. Medicare carries 2 late enrollment penalties, Part B and Part D. If you need help with that late enrollment penalty and challenging that, you can go ahead and check this video where I go over the steps to take to appeal that Part D late enrollment penalty decision. For numbers 6 and beyond, we're going to talk about Medicare insurance plans. Just like how I talked about Part D in number 1, we're going to have to reevaluate those Medicare insurance plans. If you have trouble or you want to find out if you want to get a Medicare supplement or Medicare Advantage, you can go ahead and check this video up here where we go over the difference, the pros and cons between the two. Now let's skip ahead and go to the Medicare supplement crowd. If you're on a Medicare supplement, you actually can change your plan at any time based on your health. When is a good time to change? Well, if you have been on your plan for more than a couple years and you notice that it's getting progressively more expensive, check to see rates of comparable plans in your area, because if those haven't experienced the same rate increases, it might be beneficial to change company or change plan letter. You can check out the plan letter video here as well. How do you change your plan letter? Well, it begins first with underwriting and finding the plan that might save you some money. So if you need help finding that plan and no one else is doing it for you, go ahead and send me some information that I need down there so I can see if there's a better plan in your area. Same plan, maybe different company, could save you $10, $20 per month, which can add up over time. Now with the Medicare Advantage crowd, make sure, of course, that your drugs are covered. All the doctors are in the network, still in the network. And number 3, that you actually know where your billing's going to, where your claims are being handled. Many large insurance companies actually don't administer the claims at the local level. There's a third-party administrator who does all the claims in your local community, county, or state. Make sure you know who those people are so you can get in contact with them if you have any issues with claims. And also for those of you on the Medicare Advantage program, make sure you check the big ticket items, the hospital inpatient copays, the surgery copays, and how they handle the maximum out of pocket. Also check to make sure that your plan is an HMO or a PPO. If you want an HMO plan, sign up for the HMO plan. If you want a PPO plan, make sure that you're not in an HMO plan. The benefits may look the same, but that PPO HMO makes a huge difference when it comes to getting services covered. Smaller but more frequent things like doctor visits, lab work, and different diagnostic tests may be small but can add up. So if you see a doctor more than once a week or get labs done weekly, make sure that lab copay is something that you can afford throughout the entire year. Remember now, 52 weeks in a year, a $10 copay, that's $520 every year just for that copay. Well, I hope that helps you figure out how to save more money on your Medicare program. If you have any questions, please leave them in the comment section down below. Like the video and subscribe for more information about retirement planning, Medicare, and health insurance. And I'll see you in the next video.